أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين. ثم أما بعد، الحمد لله الذي هدانا لهذا وما كنا لنهتدي لولا أن هدانا الله. إن الحمد لله نحمده ونستعينه ونستغفره ونعوذ بالله من شرور أنفسنا وسيئات أعمالنا. من يهده الله فلا مضل له ومن يضلل فلا هادي له. رب اشرح لي صدري واحلل عقدة من لساني يفقه قولي. أستهل حديثي هذا بتهنئة رسولنا الكريم عليه أفضل الصلاة وأتم التسليم بحلول الشهر الفضيل، حيث روي عنه صلى الله عليه وسلم أنه كان يهنئ الناس بالقول: أتاكم رمضان شهر مبارك فرض الله عز وجل عليكم صيامه، تفتح فيه أبواب السماء وتغلق فيه أبواب الجحيم وتغل فيه مردة الشياطين، لله فيه خير ليلة خير من 1000 شهر، من حرم خيرها فقد حرم. Ramadan Kareem, dear brothers and sisters in Islam. I would like to start my talk by thanking and praying for all people who are standing behind this wonderful opportunity. Brother Khalid, Sister Albina, who's with me here, Dr. Yusuf, Khalil, and all the brothers and sisters who are working behind the scenes, who make this opportunity possible for us, for not only for our local communities here in Wolverhampton, but also for all our good friends tuning in from all over the world. Thank you very much. May Allah reward you and all of us the highest paradise in these blessed months and of Ramadan. Fasting, as we are all aware, is one of the 5 pillars of Islam. And I find it very interesting that out of the 5 pillars, fasting is very special, is very peculiar, and this is reflected in many aspects. I've done my homework last night just to give you some examples why I find fasting very peculiar in Islam. And to be frank, the examples were very several, like uncountable examples, but I'll just give you 7 examples, 7 hadiths and ayahs, which reflect on what I'm alluding to, that fasting is very special in Islam. The first one is أحب العبادات إلى الله الصيام. So the most dear deed of worship to Allah is fasting. This is very obvious, and one of the reasons that why fasting is the most dear deed of worship to Allah is rather philosophical. I like philosophy in understanding some of the texts. So there is a saying that when you fast, you raise yourself to a higher level by stopping some of the actions which are done. I'm so glad to have Sister Alvina and Sister Sajida with me here. So if I'm looking around, that means I'm talking to them. I don't know if the camera can show you them. So what I'm trying to say here is when you fast, you raise your spirits and soul to a higher level, resembling some of the traits of Almighty Himself. So you stop eating, drinking, doing what we normally do as human beings, and this is these are sifat min sifat al-haq. These are traits of the Almighty Himself. So this is we have like ليس كمثله شيء وهو السميع العليم. He has got his own traits, and when by fasting you go that higher level where you resemble some of the traits of Almighty Himself, and this is a very high level. And then in the Holy Quran, we all know that the Quran has been revealed in Ramadan, and there is one night in Ramadan, Laylatul Qadr, which is better than 1,000 months. So, أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان. So if you count 1,000 months, this is 30,000 days. This is 85 years. So you just imagine that you have been, you are 85 years old. I know you are much younger than 30, 21. But but if you are 35 years old and you have been worshipping the whole of your life, this is how one night Laylatul Qadr is worth. So إنا أنزلناه في ليلة القدر ليلة القدر خير من ألف شهر تنزل الملائكة والروح فيها. Now, one of the other reasons is Almighty has made it very clear that Ramadan is special. So there is no more clear than this Hadith Qudsi. We know Hadith Qudsi is not Quran, but it's Allah's wording. And he said, كل عمل ابن آدم له إلا الصوم فهو لي وأنا أجزي به. يعني, if you want to translate this, all your deed is a deed of worship is for yourself. However, exceptionally, fasting is for me. This is Allah is speaking to us, and I reward for it. So he kind of accepted fasting from all other deeds of worship and made it for him to reward people for. This is very intriguing. And then I find that for myself, this is very personal. I find that it's not only in our life fasting is special, but it extends to the Day of Judgment also. And I found it very intriguing that out of the many doors of paradise, there is one door allocated for very special people, and this is Al Rayyan Gate. Is just for fasting people, and this is the exact reason why I've given one of my daughters the name of Rayyan because of this reason. So في الجنة باب يقال له الريان لا يدخل منه إلا الصائمون. And then more examples are coming. Is I find this very interesting also, that للصائم فرحتان يفرحهما. So all fasting people, they have two times when they get so blessed. The first time is in dunya, in our life, and the second time is in the Day of Judgment. So in dunya we get happy when we break our fasting. However, more importantly, we get happy in the Day of Judgment when we see Allah subhanahu wa ta'ala. Subhanallah. So إذا لقي ربه فرح بصومه. So if you're fasting, you'll be happy when you see Allah, and if you are breaking your fasting in the day in life, you'll be happy. So there is nothing better than that. One last point I just want to clarify here is most people they have a very good opportunity to have their prayers and du'as accepted while they are fasting, and people don't understand that. So the hadith says that if you are doing your prayers and du'a during breaking fasting, they are accepted, guaranteed. So what I do normally is I start just before breaking the fasting, and then while you're having dates or breaking your fasting, you just carry on doing your whatever dua you want to do. So all these things make fasting very special in our religion. Then I move very quickly just to say something about why I make the name of my program Reset Your Fasting, Reset Your Body with Fasting, because this is scientific. This is a scientific name. Fasting has been proved to be by science, scientifically very useful. There are so many health benefits. Maybe we'll get another chance to talk about this in the future, that fasting basically keeps you alive scientifically. I'm not talking from the religion point of view. There are general rules before I go into diabetes. So in the first part of this program, I'll just talk about the general rules of fasting, and then we'll answer the general questions and go into the more questions about diabetes. So the general rules of fasting. So I found there are three questions. Who's supposed to fast? Number one, when are we not supposed to fast? So when shouldn't we fast? And then who decides when you can fast and when you can't fast? So who's supposed to fast? This is all for all adult Muslims are instructed. So the default is fasting for all adult Muslims. يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. So this is for all people. However, there are exemptions, and we all know that the exemptions is if you are sick, فمن كان منكم مريضا, or traveling in a journey أو على سفر فعدة من أيام أخرى. These people are supposed to do their fasting some other time when they are not fasting or sick. However, some people are not able to fast, and I find it very interesting that people say they are not able to fast. And in the Quran, it didn't say they are not able to fast. They say على الذين يطيقونه فدية طعام مسكين. يطيق in Arabic, for the Arabic speakers, is not not being able to. It's being able to, but with some hardship. So it's even if you can do it, but with some difficulty. This is يطيقونه. You know, in Arabic when you say لا أطيق, I can't do this. But when you say أطيق عمل شيء, that means I can do it, but with some hardship. So for those people, this is like a permanent exemption, and then they just have to feed one poor person as a ransom. Uh, Now, these are the first two questions: who's supposed to fast, and who's supposed not to fast, or the exemptions for fasting. But the third question is the most difficult question: is who decides who fasts and who doesn't fast? So, is it scholars? Is it doctors? Is it yourself? I find it a combination of both. It's very intriguing that it's all about you. So you decide when you can fast, but you get some guidance from scholars, and scholars are guided by doctors in health issues, and doctors will be guided by yourself in giving some advice of what you have and what you don't have, because there is no hard and fast rule of what you can do and what you can't do. But in generally speaking, the rules are guidelines, and then you decide according to whether you can afford it, or whether you are whether it's safe for you. It's all about safety, whether it's safe for you to fast or you can't fast. And it's interesting that it's a very fine balance between being safe and being harmful, because if fasting is harmful to you, you shouldn't do it. Don't think you'll be rewarded for fasting if you can harm yourself. It's haram. Actually, I find it very easy to say haram. If there is harm, if you just add an R somewhere in the middle, it becomes haram. And harm is haram. And I'm not making this up. The hadith is la darara wa la dirar. So if you are harming yourself, this is haram. However, fasting is not easy. There is some difficulty in fasting. So you just have to strike the balance between being able to fast and not putting yourself at risk. So fasting safely, because fasting is not easy. Fasting is difficult, but you need to make sure that you fast safely. Now we move to diabetes, and as I said in the second half of this episode, I'm going to cover diabetes. I'm neither a scholar nor a diabetologist, but I have some idea. I've been doing this for some time as in all Ramadans in different platforms, and I've got a diploma with distinction in diabetes from the University of Leicester. I work as a heart surgeon. We have a lot of diabetic patients, and I did a lot of research in diabetes, so I presume I can give some advice. Generally speaking, the advice is taken from some medical references, such as American Diabetic Association Standards of Medical Diabetes Medical Care, and this has the latest version has been published recently, only a few months ago. And then I've got this very valuable document from the Muslim Council of Britain, MCP, about Ramadan and diabetes. They have got some guidelines. So these are, as I said, these are all just guidelines to tell you more about diabetes from the medical point of view, and more about when you need to fast and when you have got the license not to fast. So before I go into that, I just want to make it very clear, and I'm not talking for all doctors. I'm just taking for myself. How do I do this? So it's a very difficult responsibility when you are asked about fasting. So you should make sure that you're in a position to answer this question, because if you want to tell somebody to fast or not to fast, this is a combined responsibility. You should be equipped by the both the medical as well as the religious information enough to do that. So for myself, I divide it into two extremes. Some people are supposed to fast. Some people, they need to fast. This is the default position for them. On the other extreme, you find that some people who should not fast. So as a doctor, I can tell somebody that you should not fast, full stop. But I can't say to somebody that you should fast, because the reasons for not fasting are divided into medical and non-medical. So if I can say that you have no medical excuse not to fast, but I can't say you shouldn't fast. And for the people who shouldn't fast, I can say confidently you shouldn't fast. For example, as I will tell in the second part of this talk, if I have a pregnant lady who's diabetic, I will tell her for sure you shouldn't fast. As a doctor, I'll say you shouldn't fast, because you're not only putting yourself in risk, you're also putting your baby's life in risk. However, there is a middle ground. In the middle ground, you find some people who can fast, but they just need to try and see. And the middle ground, I also divide it into two extremes. So for some people, I say you are able to fast. And for some people, I say you have the license not to fast. So you are able to fast doesn't mean that you should fast. And it doesn't mean you shouldn't fast either. So you should try, but your default is fasting. So if we say like it's not 50-50, it is 75%, 25%. If I say for somebody you are able to fast, that means you have a problem, you have a medical problem, but that doesn't stop you from fasting. You should try fasting, but you shouldn't try hard. You should have like a lower threshold to break your fasting if you feel tired. But when I say to some people, you have the license not to fast, that means his default should be not fasting. So you can tell somebody that you shouldn't fast. As I said, a lady who's diabetic and pregnant. But for some other people, you say you have the license not to fast. So it's up to you if you want to fast and try, but don't try hard. If you should have lower threshold to break your fasting. So this is how it works. In the remaining part of the first part of this episode, I'm just gonna give very quick idea about diabetes as a disease, a medical idea before we start talking about who should fast and who shouldn't fast. Diabetes, as we all know, is classified into different types. Type 1 when you have absolute insulin deficiency, so your body cannot produce insulin, and this is normally hereditary. So it's like genetic runs in families, and it usually affects people at younger age. While type 2, which is the most common type of diabetes, like more than 90% of diabetes is type 2. These are the people who develop it over time, progressively in adulthood. They get this what we call insulin resistance. So they have insulin, relative amount, a small amount of insulin, but they cannot use it because of insulin resistance. And then there are other types, including gestational diabetes, which is temporary only during pregnancy. However, it might disappear after pregnancy, and some other pancreatic diseases or cystic fibrosis. But our concentration will be on type 1 and type 2, and type 2 is the most common, as I said. How to diagnose diabetes? There is a stage between normal life and diabetes called pre-diabetes, where people are vulnerable or susceptible to be diabetic in time, and these have got numbers. So we measure the blood sugar during fasting, at least 8 hours of fasting, and then 2 hours after having a meal. And then there is a cumulative, what we call A1C, and this will give you an idea about the glucose control over the last 20 years. There are numbers and tables for when you are pre-diabetic. If you are pre-diabetic, that means you are very likely to get diabetes, and in this case, you need to be careful. And then if the numbers progress, you will go into the diabetic range. I'm not going to give you the numbers now, but generally speaking, you have to be very careful, and you have to look for it. So we discover a lot of people with diabetes in the hospital incidentally. So they have been diabetic for some time, and we didn't know about it. That's why the risk assessment is very important. There are 6 factors in the risk assessment, including the age, the sex, gestation if you are a female, and then family history of diabetes, or if you have any weight problem or physical inactivity problems. So these are the people who are at high risk, and they need to be screened by checking their blood level for diabetes. If we move to management, there is conservative management. Generally speaking, if you start by lifestyle, weight loss, increasing your physical activity, these are the first line, and then you go into medications, and medications are divided into tablets. For tablets, you give some tablets to stop the insulin resistance, and some tablets to increase the insulin secretions. So there are 2 types of tablets. The reason I'm saying this is in the second part of this, when we talk about people who should fast and people who should not fast, there are 2 groups of people in the tablets. Insulin is a separate group, which is mainly given for type 1 diabetes, but some people with type 2 diabetes will also need insulin at the end. And I'm not going to go in depth in the insulin types, but generally speaking, you can have it as basal insulin, like once per day, or you can have it twice or 3 times per day. It can be rapid acting insulin, intermediate acting, or short or long acting insulin, and then now they're using insulin pumps, so it's continuous insulin. The last line of treatment, which is a new thing that people can have pancreatic surgery, like pancreatic and islet cell. These are the cells which are producing insulin. They can be transplanted. So the complications, there are many complications of diabetes in general, because these are important when when we are grouping people into groups, different groups. Complications will feature in the high risk group, and complications of diabetes are so many. Diabetes affects almost all organs in the body. So people with microvascular disease, that's like food problems, they have heart disease, liver disease, kidney disease, nerve disease, vision disease. So these are all considered as complications. So all complications of diabetes will fall under the umbrella of the diseases that fall in the high risk group, where people are not supposed to be fasting. So just to recap, that if we want to decide who should fast and who shouldn't fast, there are three questions. So who should fast? The default that all people should be fasting unless there is a problem. So كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون. Now the exemptions, we said there are three groups of people who are not supposed to fast, and these are the people who are sick, people who are traveling, and people who cannot لا يطيقونه, who cannot afford it, or who can fast but with some hardship. So the exemptions are divided into temporary and permanent. If it's temporary, you just have to make for the days, and you can enjoy the short winter days. If we're doing summer Ramadan in summer in the UK now, these are very long, difficult days. But in winter it becomes very short, easy fasting. So you can just fast for 8 or 10 hours in winter, and there is no problem with that at all. You can just make up for the time you can't do during summer. However, some excuses are permanent, like if you can't fast because you're frail, because you're old, or because you are sick with a disease that's not going to heal. So these excuses are permanent, so you can't make up for it. In this case, you have to do ransom, so you have to feed one poor person per day. And then the last question was who decides. We said it's a combined decision. It's mainly your decision, but the doctors and the scholars will just give you guidelines, like what we will do in the second part of this program. Who decides not to fast is yourself, guided by scholars and doctors. And the decision, as I said, is either, as a doctor, I can tell you not to fast for sure. I can say you shouldn't fast, full stop. But I can't say you should fast, because it's not only medical problems that stop you from fasting. Some other problems. You might be traveling. You might just be frail or old. You might just don't want to fast. So I can't force you to fast if you don't want to fast. However, the middle ground is more interesting. So there are some diseases which you can try to fast, but it might be difficult, and there are some diseases which you can fast and you can make it. So I divide what I tell people in the middle ground, that you can either I can either say you are able to fast, or say you have the license not to fast. So if I say you are able to fast, that means your default should be fasting, but don't try too hard to fast. You have a lowest threshold to break your fasting. And if I say you have the license not to fast, that means your default is not fasting. So you should, even if you should try to fast, you try to break your fasting if you have any problem. So this is generally speaking the guidelines, and in the second part of this program, I'm going to go on more depths in dividing the people with diabetes into subgroups according to the risk: high risk group, medium risk group, and low risk group. And we're going to talk about what each group of these people should do with regards to fasting. But again, we shouldn't forget the general rule that it's your call. It's you who decide whether you want to fast or not to fast. So in the remaining 1.5 minutes of this, I'll just have a look if there is any question. I've got some questions coming up here, and if Sister Alvina can help you also by putting some in the sheet. I think I'll just go through the WhatsApp questions, and you can put some in the sheet or something on there.
If you click on there, let's have a look. Let's come on. Right. Oh, is that?
Yeah, this is just sending me, I think, one of the brothers from Qatar.
It looks like, yeah. You can give them a mention if you know who they are.
Yes, thank you very much. I think this is Al Hadi from Qatar. Okay, we'll keep an eye on the questions, and then we have like 1 minute left, so we're just gonna put some nasheed less than 1 minute
No, you can just
before the break.
mention a bit what you got coming up.
Okay, so what I've got coming up is the people with diabetes are generally divided into three groups. So I found that there are many guidelines, but being in the UK, we just follow the Muslim community of UK, and they divided the people who are diabetic into three major groups: high risk group, moderate risk group, and low risk group. In the second half, we're just going to tell which in each one of these groups. However, I can tell you about the rules. So the high and moderate risk groups shouldn't fast. They should not try to fast during Ramadan. It's only the low risk group who are supposed to try fasting, but they still have the license not to fast. So I'm afraid now we just have 10 seconds to go to the break. So it's going to be a short break, I think 10 minutes, 3-4 minutes, and then we'll resume by talking the second part about who should fast and who shouldn't fast in the diabetic people. Thank you very much for listening, and also have a look at the questions meanwhile if you have any questions coming up. Thank you very much. See you after the break. Thank you very much. Sorry for the break was a bit longer than expected, and I'm just joining you back now after the break with the second part of this presentation, which will cover the guidelines for diabetic people when to fast. And as I said before the break, that we divided the people into three groups according to the guidelines from the British Council of Muslims, high risk group, moderate risk group, and low risk group. So out of diabetic people, if you fall in the high or mid or moderate risk group, you shouldn't fast, and if you fall in the low risk group, you can try to fast, but you still have the license not to fast if there is any problem. So we start with the high risk group. So the high risk group, if you are type 1, you are in the high risk group. If you take insulin more than 2 times per day, you are in the high risk group. If your control of diabetes is poor, you are in the high risk group. If you have frequent hypo, the diabetic people calling it hypos. So if your blood sugar goes low frequently, or if you have been admitted because of low blood sugar during the last 6 months to hospital, and if you have any complication, we call it end organ. So if you have kidney problem, liver problem, heart problem, vision problem, diabetic foot ulcer, and the last but not the least, for our sisters, ladies, if you are pregnant. So I'll just say that again. If you have type 1 diabetes, if you are on insulin more than 2 times per day, if you have poor control, if you have frequent low blood sugar, or if you have been admitted to hospital because of low blood sugar during the last 6 months, then you fall in the high risk group. And last but not the least, if you have complication or if you have pregnancy. If you are any one of these, you shouldn't fast. You shouldn't try to fast. You have the license not to fast. The medium group are also not supposed to fast, so because they have a problem with their control or with their diabetes, and these are people with moderate control. So if you are poor control, you fall in the high risk group. If you are moderate control, you fall in the moderate risk group. And if you have some complications, but not major complications, and if you are well controlled, but on some tablets which promote the production of insulin by the body, like glycosides. So if there is a problem with the control, if there is a problem with some complications, and if you have moderate control, you fall in the moderate group, and the moderate group is not so different from the high risk group. So if you have any one of the moderate problems or the high risk group problems, you're not supposed to fast. So you should check with your doctor. And I just want to say here, whatever we say in these programs is not replacement from the advice you get from your GP anyway and your diabetologist. These are just like guidelines which give you some advice. Now the low risk groups are these are the able. We never say they should fast. We say they are able to fast. These are the people who are able to fast. If you have type 2 and you have very good control of diabetes, on tablets, some tablets, not like glycoside, some tablets like metformin, sitagliptin, or some injections like liraglutide after checking with your diabetologist. So the well-controlled type 2s, these are the only group of people who are able to fast. By saying able to fast, I say they can fast, but if they have any problem, they should check with their doctor. Actually, before Ramadan, you should always be prepared by checking with your doctor all your medicines, you're on the right medicines, your control is right, whether you should fast or you should not fast. What I'm saying here is just guidelines. So I'll just repeat that. But the people who are able to fast are the people who have very good control with type 2 diabetes, and they have no complications. So good control, type 2 diabetes, no control. Anything other than that, you fall on the moderate or high risk group. And the moderate or high risk group, these are the people who shouldn't fast. So I'm just gonna say that again. So if you have type 1 diabetes, if you are on insulin and take insulin more than 2 times per day, if your control of diabetes is poor, if you have frequent hypoglycemias, if you have been admitted to the hospital because of hypoglycemia during the last 6 months, and if you have any complications of diabetes involve many organs. The most important are the heart, the kidneys, the liver, the nerves, and the vision. So, and last but not the least, pregnancy. So if a lady is pregnant and diabetic, any type of diabetes, this might be type 1, type 2, or even gestational diabetes, which might be just temporary during pregnancy, she shouldn't fast, full stop, because she will be putting not only her life on risk, but also the life of the baby at risk. And these people, most of them, they have permanent. Pregnancy is temporary, so she can make up once she had her baby safely. She can make up for the days she hasn't made, like 1 day per each 1 day during winter time, for example, when we have very short days. So she can enjoy having her breakfast at 5 or 6 o'clock in the morning, and then late dinner around 5 to 6 o'clock. So the difference in the fasting hours in the UK is very vast here. So in summer we do fast for very long times. However, in winter the fasting is very short. So there is no harm at all if you don't fast in summer for any reason. You can fast these days in winter time. Um, if um, if you have a permanent problem, like if you have complications of diabetes, then this will always be there. So if you are taking insulin and it hasn't been changed more than 2 times a day, or if you have type 1 diabetes, these are permanent problems. You cannot make up for the days that you don't fast. So you move to the second compensation, which is the ransom, or feeding one meal for the poor per day. I can see some questions coming up here, and I will try to answer common questions, and this will cover most of the questions we are having on the screen here. And then if we have any question coming up which we haven't answered, we will just add it to the list of questions. So the first question is about temporary and permanent excuses. So as I have just said, that temporary excuses are the excuses that you need to make up for the days you haven't fasted by fasting and some other time, and the trick in the UK here is to fast during winter time. While permanent problems is if you're frail, if you're old, if you have type 1 diabetes, if you have complication, that is not supposed to go in time. It's not going to go in time, so you just have to feed uh, um, one meal, one poor person per day. This is difficult for some people. So there are so many institutions, charity institutions, that can do that for you. You just pay per day, like Islamic Relief, Islamic Aid, Muslim Aid. There are so many examples of institutions who are doing this for the ransom for fasting. So there is an equivalent amount of money which you can pay, and it goes for charity by the intention of compensating for the days that you haven't fasted. The second question is about. I've got a question in the screen about the preparedness. So we advise all diabetics to prepare very well before Ramadan. First of all, you need to make sure that you are on the right treatment. You need to make sure that your control is very good, and you need to decide based on what we're saying now is whether you want to fast or you shouldn't fast, or you want to give it a go and see how you go. The timing of having your medicines should also be planned, in the sense that if you have long time between suhoor and fasting, then you can, if you are on a tablet that can be taken, for example, 2 times per day, you can take the first tablet just before um, you break your fasting immediately after the time, and then the second tablet will be last. You might need to modify the dose with your doctors, especially the second one, because you'll be fasting after the second dose. So these are the kind of things that you need to get prepared for before fasting. And for pregnancy, there is no need to prepare. If ladies, sisters, if you are pregnant and have any type of diabetes, you just actually, pregnancy by itself at some stage is an excuse not to fast. So I'm not going to talk about that now. We might cover it in another episode. So we might get one of our gynecologist or obstetrician colleagues to talk about this. But if it's combined with diabetes, then no fasting. Uh, this is a very big, gigantic, enormous no. If you're pregnant and diabetic, you shouldn't fast, full stop. The medications, as we said, that some of the medications, generally speaking, the tablets, you can try to fast if you are type 2 diabetes, well controlled on tablets. Insulin, if you are type 1, you shouldn't fast. However, some people with type 2 have insulin, and some types of tablets, you fall under the moderate, like glycolazide. These fall under moderate. So the general rule that the tablets, if you are well controlled, you can fast. Insulin, if you're type 1, you shouldn't fast. Now there are three why fasting might be a problem with diabetes. Actually, for some people with type 2, fasting is good. Fasting proves to be a good treatment for well controlled type 2 diabetes. This is a scientific fact. However, why do we say like people with high risk or moderate risk shouldn't fast? There are some problems when you are fasting. There are three main problems. The three main problems: your blood sugar might go low because you're fasting, you're not having any calories, or you might have had a high dose before starting fasting. And the reverse can happen. So if you have had low dose or had a lot to eat, your blood sugar might go very high because your control is not good, and this can happen during the night time when you are not fasting. So you might in people with type 2 diabetes, the blood sugar might go, even in type 1, you might be admitted to hospital because of high blood sugar when it causes a complication called diabetic ketoacidosis. And the third problem is dehydration. So diabetic people tend to get dehydrated. So these are the risks. And as I said, in summertime now in the UK, we have very long days. So this is people are more likely to get dehydrated and more likely to get high dose or low blood sugar during the daytime. And this is why you should have very low threshold, even if you are in the low risk group. If you have any problem, that you need to break your fasting. There is a special group of the people who have low blood sugar, and this is a very dangerous group. That these are the people who don't feel the symptoms. Their blood sugar. It's a very good habit, especially when you are, particularly when we are starting fasting. There is a very good habit that you need to check your blood sugar level in order to make sure you have good control. Because most people, they feel the symptoms when the blood sugar go down, which is good, but not all of them. Some people, they don't have awareness of their symptoms, and this is a very dangerous group of people because they will not be aware that their blood sugar is going down until it's too low. And by too low, we mean for fasting, when the level goes below 3.3 millimoles per liter, you should stop fasting immediately. So if you have the device to check your blood sugar at home, regardless of which group of risk you fall in, actually regardless of whether you have diabetes or not, if your blood sugar, generally speaking, even if you are not diabetic, if your blood sugar is below 3.3, you should break your fasting immediately. And then we are just going to say what you need to do. Once you break your fasting, you should have a fruit glass or any source of calories like a Lucozade bottle, or having some sugar in a glass of water. What you need to do is you get your blood sugar back to 4 and above immediately. And once that's done, then you can have a good snack like a sandwich or a toast slice in order to bring your sugar slowly back up. This is a medical emergency. It has nothing to do with diabetes or any type of diabetes. If your blood sugar is too low, then you are putting yourself at risk, and there is no harm in Islam. So you should break your fasting immediately. Uh, the signs or symptoms of, generally speaking, of hypoglycemia or low blood sugar include, these are well known by most of the diabetics. So you get sweaty, you feel thirsty, you feel hungry, tremors, you feel palpitations, you feel pale and anxious. These are the signs. But as I said, some people, they don't have signs. Uh, the timing of taking the medications is also crucial. If you want to fast, if you have the only group of people who are supposed to fast, and they are type 2 diabetes who can fast, type 2 diabetes with very good control, they need to do their homework. So first of all, you need to make sure your control is good by checking your blood sugar and A1C before the start of fasting, and making sure you are on the right treatment, and making sure that you're taking the right dose. So The dose might have to be modified, or the way you take it before fasting, because just as I said, the dose before breaking the fasting might be the normal dose, but the dose before the suhoor or starting the fasting might need to be modified accordingly. So these questions, I said, like general questions, which cover most of the questions we have here. I've got one more question in the screen coming up here. However, if we get any more questions, we will cover them as we go. Now, it was very nice to have our first meeting. I promise in the coming meetings I'm going to have some guests specialized in the topics, and as I said, we'll have 4 episodes. The first episode today was about diabetes. The second episode next time is going to be about heart disease, all types of heart disease. For the people who have heart disease, what do they need to do during fasting? And the third episode, the week after next week, is going to be about fasting in COVID era, which is very important these days, because some people, they do have appointments to have their COVID vaccines, and they're asking whether you can have your COVID vaccine. Absolutely yes, you can have your COVID vaccine. However, if you have any symptoms after the COVID vaccine, we're going to cover that, and then people who develop COVID, what do they need to do? Or we will just cover all what we need to do with COVID. And the last, but not the least episode, I'm going to have Dr. Ahmed Saad as a guest with me, and this will be very interesting, because we'll talk about, from the scientific and medical point of view, how do we prepare our children. And this is a very common question. I've got a lot of people asking about what do you need to do, how can we train our kids safely to fast, because it's not always safe to train your kids to fast. You should make sure that from the medical point of view, that it's safe to train your children, and the children don't have to cheat by having got too high to eat, because you are asking them to fast for more than what they can do. This is very bad. These 3 episodes coming will be having guests whether in the studio with us here, or through Zoom from overseas. As I always do, I love Arabic poetry, so I'm gonna, in the remaining time, I'm gonna just say some Arabic poetry, share in Arabic. رمضان أقبل يا أولي الألباب واستقبلوه بعد طول غياب عام مضى من عمرنا في غفلة فتنبهوا فالعمر ظل سحاب وتهيأوا لتصبر ومشقة فأجور من صبر بغير حساب الله يجزي الصائمين لأنهم من أجله سخروا بكل سحاب لا يدخل الريان إلا صائم أكرم بباب الصوم في الأبواب ووفاهم المولى بحر نهارهم ريح السموم وشر كل ووقاهم المولى بحر نهارهم ريح السموم وشر كل عذاب وسقوا رحيق السلسبيل مزاجه من زنجبيل فاق كل شراب. Thank you very much for listening to me, and it has been a pleasure to have you today in the studio. I would like to thank all of those who interacted with us through WhatsApp or Facebook, or who listened to us through this link in the Ramadan radio. And again, I would like to thank all people who have who are working behind the scenes to make this opportunity possible for all of us. And I also congratulate all my dear friends, the presenters of other programs, have been enjoying this throughout the Ramadan, and I hope that you can also download the app from the App Store or the Google Market, and then you can be able to follow all our programs online. Thank you very much, dear brothers and sisters. We are going to go now on a break, I think, and then we will just continue our broadcasting for the rest of the day. Thank you very much.